So what we'll start off with, we'll do House Bill 119 by Chairman Bishop. Ms. Cannon.
All right. Thank you, Mr. Chairman, members of the committee. This is House Bill number 119 by Representative Bishop relative to the coverage of prescription drugs through a formulary. It requires an insurer to provide a prescriber with a list of alternative disease-specific formulary medications.
Chairman Bishop, on your bill.
Thank you, Mr. Chairman, members. It's basically what it does. It is one step closer to putting the pharmaceutical that your doctor gives, the doctor gives to the patient. It's a little bit closer so the doctor understands in the event that the insurer doesn't approve the medicine, that he knows what the next choice is. I have with me Dr. Wood, and he'd probably like to say a few things about it. I have some amendments if you want to put in the proper posture.
Yeah, we'll take up the amendments real quick. Ms. Cannon.
Thank you, Mr. Chairman. Members of the committee, the first amendment set is number 1882-1882. It's being currently passed out to the members of the committee. It has also been posted online under House Bill 119, Amendment Set 1882, consisting of 3 amendments, which the first one's technical, but they all do the same thing. Wherever it provides for the phrase disease-specific, it's going to switch that out with the word comparable.
Thank you. That pretty much described you. Got anything you want to add?
No, sir.
Is there any objection to the adoption of the amendment? See no objection. The amendment's passed. Next amendment, Ms. Cannon.
Thank you, Mr. Chairman, members of the committee. This is amendment set number 1916-1916. It's also being passed out currently to the members and has been posted online under House Bill 119. Amendment set 1916, consisting of 5 amendments. Amendment number 1 is just technical, requested by staff, but amendments 2 and 4 are the substantive ones, and it's going to add a provision that it is sufficient to meet the requirements of proposed law if the health coverage plan includes the information required by proposed law in the denial letter sent by the health coverage plan or its agent.
Anything you want to add, Chairman
No, sir.
Bishop?
No, sir, that covers it.
Is there any objection to the amendment? Seeing no objection, the amendment is passed, so now you have the bill in proper posture.
Wonderful. Thank you. Dr. Wood.
Yes. So when I
Just
first
introduce yourself. I'm sorry, your name and who you represent.
My name is Jacob Wood. I'm a physician here in Baton Rouge, and I hopefully represent all of the physicians in Louisiana, although I can't claim to do that officially. So when I first approached Stewart about this bill, it's essentially trying to fix a problem that has been around for quite a while. I've dealt with it throughout my entire medical career. I've been practicing about 20 years. But when we write a medication that is denied for a prior authorization, step therapy, or non-formulary, some of the insurances, some of the time, will provide us with the alternatives that we can write for those medications. Frequently, we just get a notification of denial. And so we're left kind of throwing darts into the dark, trying to figure out which medication is covered. It delays care for the patients. It causes us a significant burden of time to write successive prescriptions until we find which drug is covered. And I felt that this would be a benefit for the patients. It would be a benefit for the physicians. In some ways, I think it would benefit even the insurance companies as things happen more expediently. And I realize that there are potentially some increased burdens on them in notification. But if we're working together and we're writing the drugs that they approve and we're doing it in a timely manner, we're really helping the main people, which are the patients. So that was the purpose of the bill. It's not complicated. It's actually pretty simple.
Okay, the board is clear. Anybody have any questions? Any buttons pressed that I don't see? That's it. Representative Bishop, you want to close on your bill?
I want to thank Dr. Wood for being here and bringing this idea to me, and I ask for favorable passage.
Okay, I'll make the motion to report House Bill 119 as amended. Is there any objection? Seeing no objection, House Bill 119 is reported as amended. Thank you, Chairman Bishop.
Thank you, sir.
Oh, I do have 2 cards in support I'd like to read in. Jacob Wood, who we just heard from, and then Mary Beth Wilkerson from the Louisiana State Medical Society is present but does not wish to speak. Thank you. Representative Brown, do you want to do your bill next?